Hey guys, I'm Dr. Dino Pappas. Thanks for joining me. The content of this video are my views and my views alone. They do not represent the content of any entity or agency that I may be affiliated with. I had a great positive session today with a patient, and we talked about low back pain and chronic low back pain in particular. And I want to share the insights of that conversation that I had with a patient with you today. A little bit about the patient's history. They've got flares of back pain every 2 or 3 months. They feel that those flares, that the course is negative, that she'll have more significant flares, more disabling flares, greater intensity over time. She's 48 years old and she's worried about the next 20 to 30 years of her life. And this should sound familiar. It should sound familiar because what most providers and most patients think is that we all don't get low back pain. The reality is quite the opposite. Statistically, about 75 to 80% of Americans will have an episode of low back pain at least once in their lifetime. So if we frame the conversation the right way, back pain is more the norm rather than the exception to the norm. I'm going to repeat that one more time. It is more normal that you will have an episode of low back pain in your lifetime than the opposite, and that you will never have low back pain. So the question becomes, well, what do we do with back pain if it's normal? Do I have to live with it? Do I have to accept it? Do I have to accept a fate of flares and potential flares and disability? And the answer to the question is no. Let's reframe the conversation one more piece and set the stage correctly one more time. When you have an episode of back pain, it is like having a cold or having the flu. Most Americans make it through life and have an episode of a cold or a flu. And what happens? Typically within 3 to 5 days, or typically within a couple weeks, the symptoms of your cold, the symptoms of your flu resolve and things go back to normal. This same type of situation occurs with most back pain. Most back pain, if you do nothing, will get better on its own. But when you set the stage for flares in a predictable pattern every couple months or every couple years, and they become more and more disabling, the time is then present for you to seek medical attention. So we describe this to the patient, that she'll get over this episode. But we described strategies and looked for pain triggers to reduce the intensity, the severity, and the potential frequency of future flares. And if we can give you the information specific to you to reduce the intensity, the frequency, and the severity, and we frame the conversation, it is normal to have back pain, it is normal for it to go away on its own, and you only need to seek medical attention if you go 3 to 5 days and you're aggressive with your home exercises that you've been prescribed and you can't make a dent in that pain, or you have onset of pain that radiates down the leg, new onset, or loss of bowel or bladder control, those are not normal, then what you're experiencing is perfectly normal and the trend is going to be positive. So I think there's a misconception of what back pain is, what to do with it, and when it requires worry, concern, and aggressive medical management. And this video is entitled for you folks out there to better know that back pain is normal. Most episodes you'll get over with. Try to find a clinician that will work with you to reduce the flares, reduce the triggers, and implement strategies if you're in a flare to get out of it as quickly as possible, and seek medical attention with radiating leg pain, loss of bowel or bladder control, or significantly high levels of pain if you've tried things for 3 to 5 days and you can't make a dent in those. I'm Dr. Dino Pappas. I hope you appreciate this honest conversation, or a summation of this honest conversation with an actual patient today in my office about back pain. If you like these videos, hit subscribe, turn on those notifications. Thanks for watching, and thanks for joining me. 425, 425.